two abstracts which I discussed were two trials. The first was CheckMate649 and the second was ATTRACTION-4. These were first-line trials for patients with advanced gastric and gastroesophageal cancer. I'll deal with CheckMate649 first. So CheckMate649 was the largest trial ever conducted in gastric cancer. It enrolled patients with treatment-naive gastric and gastroesophageal adenocarcinoma, and they were randomized in two of the arms. A third arm, which was combination immunotherapy, was not presented. But the two arms which were presented were chemotherapy versus chemotherapy plus nivolumab. And the chemotherapy was oxaliplatin and fluoropyrimidine based, so it was either FOLFOX or CAPOX. And the trial recruited almost 2,000 patients in total. The primary endpoint of the trial was progression-free and overall survival in patients with PD-L1 CPS 5 or greater tumours. And the primary endpoint was met in that chemotherapy plus nivolumab improved overall survival for patients with PD-L1 CPS 5 or greater cancers. And the overall survival benefit was over 3 months. Median overall survival was more than 14 months for this group of patients. So that's really clinically meaningful benefit in terms of overall survival for these patients. So it's very likely that this trial will change the standard of care for patients with first-line gastric and esophageal adenocarcinoma who are CPS 5 or greater. Data sets outside the trial would suggest that CPS 5 or greater patients are probably somewhere between 30 and 40% of the population. So we'll need to validate that in other data sets to understand what proportion of patients this treatment will be suitable for. The trial also showed that patients with CPS 1 or greater tumours and all patients enrolled had a benefit from nivolumab. But what we didn't see based on this abstract, because it's a late-breaking abstract and there needs to be further analysis, is whether the treatment is effective for patients with CPS, for example, 1 to 5 or CPS less than 1 tumours. So that will need some further analysis, and I'm sure we'll see that in the manuscript. But certainly those were practice-changing results for patients with CPS 5 or greater tumours. The ATTRACTION-4 trial was an Asian trial, and so enrollment was limited to Asia, more gastric cancer patients. And again, this was a trial of oxaliplatin-based fluoropyrimidine chemotherapy, plus or minus nivolumab. It too had co-primary endpoints in progression-free and overall survival, and it met the progression-free survival endpoint, but it did not meet the overall survival endpoint. And there are a number of different reasons for that. I think most likely it's due to the increased use of second and subsequent lines of treatment, chemotherapy and immunotherapy in Asia, in particular in Korea and Japan. And that is probably enough to confound the overall survival endpoint. It's possible that overall survival shouldn't be used as an endpoint in these patients in that population because they have many subsequent lines of treatment. It's also possible, however, that because ATTRACTION-4 was not biomarker selected to the degree that CheckMate649 was, that the results could also be affected by that. So it would be interesting to see a biomarker analysis of that trial. In terms of toxicity and treatment tolerability for patients, as you might expect, we saw some increase in grade 3 and 4 toxicity with the use of immune checkpoint blockade and chemotherapy, but very few patients stopped treatment because of these toxicities, and thankfully there were very few treatment-related deaths. So it does appear to be tolerable. We haven't seen quality of life data. I'm sure that will emerge at later meetings.